Good day everyone. In today's video, we will be discussing postural drainage positions according to the various segments, bronchopulmonary segments. So first of all, upper lobe, it have apical segments. To drain the mucus from the upper lobe apical segments, so we have to make the patient sit in a comfortable position on a bed or flat surface, and he leans on the backrest. So the patient percusses and vibrates over the muscular area between the collarbone and very top of the shoulder blades on both sides. And we encourage the patient to take a deep breath and cough during percussion in order to help the airway clearance. So this is a position of the patient to drain the apical segments of both upper lobes. Then the posterior segments. For the right posterior segment, the patient lie on his left side and then turn 45 degrees onto his face, resting against a pillow with another pillow supporting his head. So the left arm should kept comfortably behind his back with right arm resting on a pillow, and the right knee should be flexed. So this is a position for draining the posterior segment of right upper lobe. Next is the posterior segment of left. The patient is lying on his right side and then turn 45 degree onto his face with 3 pillows to raise the shoulder 30 centimeter from the bed. So this position, that is the posterior segment of left side, is the only position where we have to raise the head end. So the right arm should kept comfortably behind his back with left arm resting on the pillow. Both knees should be slightly flexed. So this is the position where we are draining the posterior segment of the left upper lobe. Next is upper lobe anterior segments. So for this, the patient lies flat on the bed or table with the pillow under his head, and legs and arms, they are relaxed by his side. So the chest PT is given to the right and left sides of the front of the chest between the collarbone and the nipple. So this is the position where we are draining the anterior segments of both upper lobes. Next comes the middle lobe. So in the middle lobe, we have lateral and medial segments, and patient lies on his back with his body quarter turned to left, maintained by a pillow under the right side from shoulder to hip, and the arm should be relaxed by his side. And in this, the foot end of the bed is to be raised by 35 centimeter from the ground, and the chest is tilted to an angle of 15 degrees. So this is the position for draining lateral and medial segments of the middle lobe. So over here, the foot end has been raised. Next comes the lingula, that is the superior and inferior segments. So patient lies on his back with his body quarter turned to the right, maintained by a pillow under left side from the shoulder to hip, and the arm should be relaxed by his side, and foot of the bed should be raised again 35 centimeter from the ground, and the chest is tilted to an angle of 15 degrees. So this is a position for draining the superior and inferior segments of the lingula. Next comes the lower lobe. For apical segments of the lower lobe, patient lie prone with head turned to one side, and arm is relaxed in a comfortable position by the side. So a pillow under his hips. So lower lobe's apical segment. So we have to drain the apical segments of both lower lobes, arms removed for clarity. So for the lower lobe's anterior basal segment, so patient lies flat on his back with the buttocks resting on a pillow and knees are flexed. Again, the foot end is elevated for 46 centimeters from the ground, and the chest is tilted to an angle of 20 degrees. So this is a position for draining anterior basal segments of both lower lobes. Next are the posterior basal segments. Again, the patient is prone with his head turned to one side. Arm is in a comfortable position by the side, pillow under his hip, and foot of the bed is elevated 46 centimeter from the ground, and the chest is tilted to an angle of 20 degrees. So this is a lower lobe posterior basal segment. We are draining the posterior segment of both lower lobes. Next are the medial basal or sometime cardiac segment. So patient lies on his right side with a pillow under his hip. Foot end is again raised for 46 centimeter from the ground, and the chest is tilted to an angle of 20 degrees. So this is the position for draining the lateral basal segment of the left lower lobe and the medial basal segment of the right lower lobe. Next is the lateral basal segment. In this, the patient lies on his left side with the pillow under his hips. Foot end is raised 46 centimeter from the ground and chest is tilted to an angle of 20 degrees. So this is a position for draining the lateral basal segment of the right lower lobe. So these are the various positions for postural drainage to drain the various bronchopulmonary segments.